Hello, my name is Dr. Stefan Tóka from the Dental Clinic Dr. Tóka in Sopron in Hungary. Dear patient, I have received your CT scan from the UK and we have created a treatment plan for you and also a quotation which I'm going to talk to you about today. First of all, let's have a look at the three-dimensional reconstruction of your jaw and your remaining teeth. I would like to talk first about your upper jaw, which if you follow the cursor you can see right here. You can see that the bone is visualized in blue, in light blue. Your healthy teeth are visualized in orange, and teeth which are in a bad condition are visualized with red. Okay, so let me first talk about the upper jaw. Let's zoom in a little so we see a little bit more. What you can see here, this is your nose. Okay, this is your right side and this is your left side. Let's talk about your left side first. The last tooth you have in this row, it's tooth number 4. It has a very bad inflammation and you can see that it does not have any contact with the bone anymore. So this tooth definitely has to be removed as soon as possible. You can also see that the bone, there's a bone destruction around the tip of the root of this tooth caused by the bacteria which live on the surface of this root or the tooth itself. So the sooner this tooth gets removed, the better. In the middle, you can also see that the line of bone, if you follow the cursor here, has gone back a little bit. Yeah, you can see that this bone used to be around here. Yeah, this is the crown, the tip of the tooth. This is the beginning of the root. And if we make the bone see through, that you can see that, well, most of the bone here with these front teeth has already been lost. But I guess that they are still stable. This one tooth here, marked in red, tooth number two on the right side, is in not so good condition, very bad prognosis. So I would like to recommend that we remove this tooth. Okay. Once we have removed the remaining bad teeth in your upper jaw, we are left with 4 healthy teeth. In order to reconstruct or restore your teeth in the back of the jaw on the right and the left side, we would have to place implants. Okay, we're going to concentrate on the upper jaw and forget about the lower jaw here, or the lower implants. What I would recommend are 2 implants on your left side and 2 implants on your right side. In order to close this gap here in the front, we are going to create a bridge. This is how it's going to look like. The implants in the back are going to hold 3 crowns on your right side, and the implants on the left side are going to also hold 3 crowns. In this case, it's called a bridge. The teeth in the front, which are still in a good condition, will all get crowns, and we will close this gap which you have here on the front, on the right side of the front teeth. We are going to close again with a bridge. So my recommendation would be in the upper jaw placement of 4 implants and the placement of 12 crowns. This way you can have nice fixed teeth again. About the quotation, you will see 2 different prices, one about zirconia crowns and one about titanium crowns, and I will talk to you about that in a moment. Another important thing we have to talk about is that you have, or everybody has, a so-called sinus. If we look on the top of your jaw, you can see here your nose canal. This is where the air goes in and out while you breathe, and on the left side and on the right side you have big cavities. These are the sinuses. Now, if we have a look from the side and we want to place 2 implants here, we have to check whether or not we go into the sinus. And you can see here a very good example that the tip of the implant, which we will place right here below the last tooth, will reach inside the sinus. The sinus is filled with air, so we cannot just simply place an implant inside the sinus and hope it's going to hold. We have to make a bone augmentation. This process is called sinus lift. And what happens is that we place some artificial bone around the tip of the implant inside your sinus. This artificial bone will be converted by your own cells into your own bone, and this way we can regenerate bone where we don't have any. This way we can guarantee that the implant here will be covered with bone all the way, so we have enough stability that when you start chewing here in the back you will have a good and strong implant. On the other side, if we turn it around now, on the other side you see two implants will be placed, and if we look inside the sinus again we will see that the tip of both implants which we plan to place here will reach the sinus, so we will have to do a bone augmentation here as well. It is a microsurgery. It is a very small intervention. It looks bigger on this picture than it is in real life, so don't worry. One important thing I have to tell you about is though that once we place the implants and do the bone augmentation in one sitting and one little surgery, all of the implants, after that the implants have to stay in for a certain healing time. The healing time in the upper jaw will be 6 months. That means when you first come to us, we're going to place the implants. In the upper jaw it's 4 implants. We're going to talk about the lower jaw in a moment. So we're going to place the 4 implants and the bone augmentation in the upper jaw, and you will go home with the same denture you are wearing today. In case you have a denture, I'm not quite sure, I didn't get that information yet. If you don't have a denture, we're going to make you one during your stay here. So in your first visit there's only going to be an operation. It's going to last maybe 2 hours, not much longer, 2.5 hours, and you can basically come here in the morning, we will do the operation, and you can go back home in the afternoon or the day after. Okay? So much about the upper jaw. Let's go to the lower jaw now. Okay, just a moment here. Okay, in the lower jaw we have a different situation. You have 4 teeth left. 2 of those 4 teeth are 5 teeth, sorry. 2 of those 5 teeth are in a bad condition. I would recommend the removal of these teeth. So we're only left with 3 healthy teeth. Okay. So what can we do there so that you can enjoy a nice fixed teeth again? We are going to place 5 implants. Okay, 1, 2, 3, 4, 5 implants. On the right side, 1 in the back, and the rest on the left side and to the front. One important thing is that we have a nerve canal inside the lower jaw on both sides, and once we want to place implants in that region we obviously have to measure how long that implant can be. In your case it's 10 millimeters. You still have enough bone above that nerve canal which we can use to place nice and strong implants, almost 5 millimeters in diameter, so there's no problem. The healing time in the lower jaw usually is less than in the upper jaw. It's between 2 to 4 months, but my recommendation would be that we wait until if we place all the implants in one operation, which is no problem at all, we can do that in one operation. We do that basically every day. Then I would recommend we wait until all of the implants have healed in upper jaw and lower jaw, and only after that healing time we will create crowns for the lower and the upper jaw. Okay, so you will have in the first visit a little bit bigger operation, placement of 4 plus 5 implants in the lower jaw. That means 9 implants, and you will go back home with a removable denture, either the one you already have, or if you don't have one, we are going to make you one. Okay, so this is going to be the end result. As you can see, we're going to leave the healthy teeth inside. One tooth on the right, on your right side, will be held. One crown will be held by an implant, and a long bridge over the other part. And in the upper jaw, we will have 2 bridges. One bridge on the left side in the back, one on the right side in the back, and a 3rd bridge which will be held by your own teeth. Okay, so that will be my recommendation. Let's go to the quotation real quick and talk about that for a moment. This is the quotation you have got in pounds and obviously in English. let's go through the top part here. You will see panoramic radiograph evaluated. Maybe we don't even have to do that since you already sent us a CT. There's a CT here as well. The CT will not be, you don't have to pay the CT since you already sent us a CT, so you can forget basically about the top parts. That's almost, that is 150 pounds you can subtract from the end. We created the 3D plan, which you already saw, which is important for planning the implant positions. We're talking about the upper jaw only first. Yeah, so we're going to extract 2 teeth in the upper jaw. This is how much one extraction costs. This is how many we need. So there's no problem. We have 2 points: surgery cost and healing package. These are 2 fixed costs we have per operation, not per implant. So if we do the upper jaw and the lower jaw in the same operation, you only have to pay surgery cost once and the healing package also just once. Please talk to Catlin Price, our correspondent in the UK, about what exactly the healing package is, for example. The sinus lift is the bone augmentation, which we lead on the right side and the left side, and the upper jaw only. Yeah, you remember this part here? I talked to you about the sinus and where the implant reaches the sinus. We need those both of those augmentations. So that is the sinus lift. The implants, Alpha Bio is the producer. We need 4 implants in the upper jaw, and here also is a long-term temporary partial denture. This we only need if you don't have a denture yet. If you have a denture, it's going to be much easier to adapt, and it will not cost as much if we need to change anything. If we don't have to change anything, then basically you can forget about these costs. Okay, after this, we said after the operation we will have to wait a little while. Okay, so after the healing time of approximately 6 months, only then the prosthetic part comes. And here you have 2 options, option A and option B. Option A is you want titanium abutments or full zirconia abutments. What exactly the difference is, our correspondent will tell you or talk to you about. Then again, you have 2 options, option A and option B: porcelain fused to titanium crown and full porcelain zirconium crown. So what I want to talk to you about is that you have 2 different total prices. If we make everything out of titanium, you are £6,144, and if we make all full zirconia, it's a higher aesthetic kind, then it's exactly £8,000. Then, if we change to the lower jaw, this is the second part. The lower jaw, you also see CT scan, radiograph. This obviously you don't have to pay again. Then I said surgery cost and the healing package you only have to pay once per operation. So if we do the upper jaw and the lower jaw at the same time, you don't have to pay the surgery and the healing package again. So you can subtract that as well, yeah, which is not a small amount. Then we need 5 implants in the lower jaw, and here again long-term temporary partial denture. This is only an option if we need a new denture. We will have to create one. If you already have a denture, we can just expand it a little bit. Okay, then again prosthetic part. Oh yeah, and then comes the healing part again, and then the creation of the prosthetic part again. Option A, option B, titanium abutment or full zirconia abutment for the implants in the lower jaw. This is the abutment is the connection between the implant and the crown. The crown is the actual part that you see inside your mouth. Okay, so implant has 3 parts: implant, abutment, and crown. Okay, that is a very important thing. The crown, the third part, yeah. You will have option A and option B. We will need 12 crowns in the lower jaw, and you can choose. If we choose all titanium, £6,128, and all zirconia, £8,184. Okay. Obviously, you can subtract here some of the points I have mentioned: surgery cost, healing package, and so on and so on. Okay. I hope I could help you, and if you have any questions, just please talk to our correspondent. She will tell me either via by phone or send us an email, and we can arrange all the information you need. Okay, thank you. Bye bye.